Hey there, pull the privacy curtain. My name is Tony. I'm going to be your student nurse today. I'm going to wash my hands. Could you please tell me your name and date of birth? Okay, I'm going to double check your wristband. Good, that matches. Lou, do you have any allergies? Penicillin? Okay, we're not going to be using any of that today. So, I'm here because the doctor told me to come in and give you some meds. It looks like on your MAR that you're going to be receiving some furosemide and acetaminophen. Furosemide is a loop diuretic. It works in the loop of Henle of the kidney by excreting electrolytes like potassium, sodium, and chloride. It is indicated for edema and or hypertension or fluid overload. Some side effects you may experience with that are orthostatic hypotension or nausea, vomiting, or diarrhea. Acetaminophen is a analgesic medication or a pain med. This one's for mild pain. It works by inhibiting the prostaglandin synthesis in your brain. Some side effects you may experience with that are tachycardia or hypertension. So, Lou, I'm going to do a quick abdominal assessment real quick using my stethoscope. I'm also going to place the head of your bed up to 45 degrees. Before I came in here, I also made sure that both these meds are not expired. So the next thing that I'm going to do is do my 3 checks with these meds. So this is acetaminophen for Lou Johnson, 650 milligrams at 0800, and he's not allergic. This is Lou Johnson receiving acetaminophen, 650 milligrams through his NG tube, and he's not allergic. This is Lou Johnson receiving acetaminophen through his NG tube, 650 milligrams, and he's not allergic. And this is Lou Johnson receiving acetaminophen, 650 milligrams through his NG tube at 0800, and he's not allergic. Next is the furosemide. This is Lou Johnson receiving the furosemide, 40 milligrams through his NG tube at 0800, and he's not allergic. This is Lou Johnson receiving furosemide, 40 milligrams through his NG tube at 0800, and he's not allergic. This is Lou Johnson receiving furosemide, 40 milligrams through his NG tube at 0800, and he's not allergic. So, next thing I'm going to do, Lou, is put some gloves on because now I'm going to crush your medications. I'm going to be touching them, so I want to be wearing gloves. So the first one I'm going to do is the acetaminophen, the 2 tabs. Put them in this napkin here. I'm going to use these spoons to crush it today. Put the crushed meds into the cup. I'm also going to add 15 milliliters of water to this to mix in with your med. Next, I'm going to crush the furosemide. Put the crushed med into the cup. I'm going to throw this away. I'm going to pour 15 milliliters of water into this one too. So before I do these, before I give these to you, I'm going to come look at your NG tube to assess its placement. By measuring it and looking at it, I can tell that it hasn't moved, it is in the right spot, and that I am now able to give you your meds. So before I do that, I need to do a 15 milliliter flush of water through your tube. There's that. Then I'll first give the acetaminophen. Then I will do a 5 to 10 milliliter flush of water in between meds. And then I will do the furosemide. Now, since that is the last med, I'll do a 30 to 60 milliliter flush of water. If Lou was a pediatric patient or someone on fluid restrictions, then I would limit that to 5 to 15 milliliters, but he's not. So next I'll make sure that everything goes all the way down. If Lou was receiving suction through the NG tube, I would have to wait 30 minutes. Also, if he was receiving feeding through here, I would have to start that back up. But since he's receiving furosemide, which is a med that needs to be given without food, I'm not going to hook that back up. So next thing I'll do is remove my gloves, throw them in the trash. I'm going to re-sanitize my hands. Now Lou, if there's nothing else that I can do for you, I'm going to raise your guardrail back up. I'm going to put your bed in its lowest position. And then I'm going to sanitize my stethoscope from the abdominal assessment earlier. And then if there's nothing else that I can do for you, Lou, I am going to go out to the computer and chart this. Please let me know if you need something else.